Welcome to The Gut Show. I'm your host, Erin Judge, registered dietitian and founder of Gutivate. I'm also your fellow IBS warrior. Our goal on this side of the internet is to empower those with IBS and digestive disorders to understand their gut better, to have a healthier relationship with their bodies, and to make confident choices to improve their digestive health. During this season, you can expect a conversation around a hot topic related to gut health, digestion, and IBS. As a disclaimer, I am a dietitian, but I am not your dietitian. So everything covered in this episode is meant to be educational and is purely information that you can take back to your healthcare team in order to make the best decisions for you. If you're new here and something just doesn't feel right in your gut, if your symptoms have led you to this podcast, I invite you to start by taking the quiz, What's Your Poop Personality? Your personality type will unveil what your symptoms may mean, what may be causing them, and what you can do about them. This is a free quiz and you can take it today at gutivate.com or find the direct link below in the show notes. While you're going to take the quiz, let's jump into today's episode. Now for a quick word from our sponsors with resources that might support you. It's well known that a low FODMAP diet is one of the most effective and evidence-based ways to alleviate IBS and SIBO symptoms. But it can also be challenging to get it right. With Modify Health, following a low FODMAP diet is crazy simple. Enjoy expertly crafted, Monash certified, low FODMAP and gluten-free meals, fully prepared and delivered right to your doorstep. Simply heat and enjoy. Plus, they offer one-to-one dietitian support covered by most insurance plans to guide you every step of the way. Go to modifyhealth.com, select your meals, and save 35% off your first order, plus get free shipping across the U.S. with the code THEGUTSHOW. All one word, THEGUTSHOW. If you're dealing with SIBO or ongoing gut issues, you've probably heard how limited the options can feel, especially if antibiotics aren't a great fit. One evidence-based approach is the elemental diet, and Mbiota Elemental is a formula developed by leading gastroenterologists and food scientists. What I love about it is that it's clinically effective and easier to drink than traditional elemental formulas. You can learn more at mbiota.com, that's MBIOTA.com, and save 20% on their 2-week protocol with the code GUTIVATE, GUTIVATE, GUTIVATE. A low FODMAP diet works for IBS, but it also kind of sucks. So what if you could get the benefits of the diet without restricting all your favorite foods or stressing out over meals that you don't cook? FODzyme makes that possible. It's an enzyme that breaks down FODMAPs so you can digest them better and prevent FODMAP-related symptoms. You simply sprinkle it on your meals and eat the food you love, letting FODzyme do the hard work for you. If you want to try FODzyme for yourself, go to FODzyme.com and use the code THEGUTSHOW, all one word, THEGUTSHOW, for 20% off your first order. And now let's get back to the show. Welcome back to The Gut Show. I promised you this season that we were going to have some incredible guests to talk about very hot topics. And today is one of those days. I'm thrilled to have our special guest, Dr. Wendi LeBrett, or as you may know her on social media as SoCal Gastro Doc, to talk about it's a hot topic, but maybe not as sexy as it probably should be, and that is liver disease. So thank you, Dr. Wendi, for coming on. Before we get into the episode, I want to just share who you are and your role in the GI space, what you do and what led you to social media.
Well, thank you so much, Erin, for having me on the podcast. I am Dr. Wendi LeBrett. I am double board certified in internal medicine and gastroenterology, and I work as a practicing gastroenterologist. So I am a general gastroenterologist, so I see everything ranging from liver disease, which is our topic today, IBS, inflammatory bowel disease. I do a lot of colon cancer screening. So all of that is within my wheelhouse and my passion. And then, as Erin alluded to, I am SoCal Gastro Doc on social media and educating people about their digestive health, making sure that people can get accurate information about their gut health is one of my passions. So that is a big part of my platform. And then I also work on educating other healthcare professionals on social media and how to work with the public and the new trends with education.
Amazing. And everyone here, every listener of The Gut Show, anyone in our community knows that we love practitioners, and I am one myself. So I'm very biased to this opinion, but we love practitioners that bring education and resources directly to patients, and social media is one of the best ways to do that. I think especially as healthcare gets even more complicated, access
Mhm.
even more complicated, it can be hard to get really reliable information about the topics that maybe aren't as, again, sexy, like even IBS and the management
Right.
of functional disorders. And colon cancer is getting there, but even like prevention maybe is less sexy to talk about.
Mhm.
There's less money maybe in it. And so it's really helpful to have that. And so I'm glad that you do that. That's how I connected with you. I followed you for
Yep.
almost a year, I think, on TikTok before we then connected on Instagram. So big fan.
And then we met in person finally.
Yeah, we have to meet at a conference, and I'm excited. So I'm excited for today's conversation. And I brought you in to talk about liver disease because you do such a great job educating on this. And unfortunately, it is on the rise, and it kind of like it's like colon cancer in a way. I feel like they both sort of like slipped in, sort of in this post-COVID, like 20 to
Mhm.
25 period of time that felt like it was only a year. And now we're like, wait, there's a lot of issues that are happening that we have not been addressing from like a healthcare standpoint. And liver disease is one of those. So before we get into why it's happening and all of that, can you break
Mhm.
down like what is liver disease when I say that? And what are the different types of liver disease?
I like to think of it as a gastroenterologist as acute and chronic liver disease. So, acute means there's something that happened to your liver, there's some sort of injury or insult to the liver. That could be an infection, it could be a reaction to an toxin or medication. And then that's sort of an isolated event, and then your liver recovers. Some people who have an acute event to the liver can also develop chronic liver disease. And so, chronic liver disease, we think of that as long term inflammation, eventually leading to scar tissue in the liver, and then cirrhosis, which is chronic liver failure. Some people can also get chronic liver disease without having an acute insult to the liver, but sort of long term chronic exposures to a toxin such as alcohol, or we will talk a little bit more about this, but metabolic syndrome, so fatty liver. And those are two of the most common causes of liver disease.
So interesting. And I guess we probably should take a step back because some people may be asking this in their head, what is the liver? Like what does the liver even do and why is this so important? Because I think sometimes we think like all organs are sort of replaceable or not really that valuable, but what about the liver? What does it actually do and why does it take on this type of injury like you mentioned to like infections or medications or toxins or all sorts of things?
Yeah, your liver plays such a vital role in so many different parts of your body. So it falls under gastroenterology because does really important work in digestion. It receives all the nutrients from the small intestine, and then it helps store it and disperse it out to the rest of the body. So that's why your liver is very sensitive to what you're eating and alcohol and all these toxins, because it is one of the first processing centers and distribution centers. The liver also has other functions like making clotting factors for your blood. It has immune functions. It plays a really important role in metabolism of blood sugar and glucose and regulating blood sugar. And so the liver is a really essential organ. You cannot survive without a liver. And so liver transplants are one of the life-saving measures that can happen if somebody ends up with either acute or chronic liver failure.
What beyond getting to that point of like death, worst case scenario, death. I guess second to worst case scenario is being on a transplant list and not knowing if you're going to die or not. So
Mhm.
with it. But if you're dealing with maybe acute liver injury, or maybe you have early stage liver disease, and we're going to start talking through some of this, what are the risks? Like, how serious is it if liver disease progresses? Like how serious should we be taking it, even on that acute level?
So acute liver failure actually can have acute liver injury. It just means your liver is injured, but failure means that your liver is no longer doing the functions that it normally can do. So the liver is very resilient, fortunately. So you could have injury where your liver shows signs of inflammation, but failure is when the liver then stops being able to perform its functions, such as clearing toxins from your blood or making some of these clotting factors that we need in our blood. Injury, fortunately, the liver can survive and the person can kind of go through and recover. If you are in liver failure, whether that's acute or chronic, this is cirrhosis, then that is a very serious condition. Most people, especially with acute liver failure, are hospitalized, and then there's a really high mortality rate. So there's a very high chance that you may die. And acute liver failure is one of the indications, and probably one of the most urgent indications for a transplant. Chronic liver failure, these are people with cirrhosis. And then I also break down cirrhosis into two buckets. So there's compensated cirrhosis. So cirrhosis means there's chronic liver failure, but currently your body is not showing any signs that your liver function is not to the point where it is affecting you or causing symptoms. And then decompensated cirrhosis. So this is decompensated chronic liver failure. This is when you're starting to show symptoms of that. So whether that is ascites, so that's the accumulation of fluid in your belly, or you might have something called hepatic encephalopathy. This is when your liver can't process ammonia efficiently, and then that ammonia accumulates. You start to have symptoms of confusion. That's someone who's more sick, and that would be an indication to consider a liver transplant in the near future.
I'm glad that you covered that. And I don't love fear-based messaging. I think you're the same way based on social media stuff. And there's not always a need for fear-based messaging. I think liver disease, colon cancer, obviously, are two big ones where that is necessary to honestly speak to what's going on, because the changes that we're going to get to, of like changes you can make, or some of the causes, like they're not always the most fun changes to make, and can be a conversation. So I want to set it up just to be honest, because I do think it's going to be really important through our conversation. And if you feel a little fear listening to this, I'm sorry. I don't want you to feel fear, but also I think it's important to recognize that this is an important topic. And what's really interesting is there was a 2025 study that predicted that global liver cancer cases, so cancer specifically, we can talk about that different, but that they could nearly double by 2050 if the current trends continue. So from about 870,000 to 1.5 million annually. And about 60% of liver cancer cases are considered preventable because they stem from these modifiable risks that we sort of talked, that we're going to get into, and some of the liver injury. So outside of liver cancer, but like even liver disease, why do you feel like these cases are rising? And what do you see in your practice with the rise? Because again, we're hearing about it more from social media. I don't work with a lot of liver stuff in my practice, working more on the side, but we're seeing younger people have liver cancer and liver disease, and having these signs and symptoms you talked about, even cirrhosis, which seems crazy that that would even be possible. So why do you feel like this is happening?
Yeah, so I think there are two major things that were going on. So I think more recently in the past few years, there was a sort of alcohol epidemic during COVID where people were staying at home and a lot of people started drinking more. And so we saw like a rise in liver transplants related to acute alcoholic hepatitis. So this is an acute liver injury related to alcohol in young people. And when I was in training, we were in a transplant centers and we would see, 20-year-olds getting liver transplants. And we really attributed that to some rise in alcohol usage and like binge drinking during COVID. There does seem to be some trends in improvement. I have been seeing data that especially Gen Z is drinking less than millennials and some of the older population. So I think that's promising. And I do see a lot of discussion on social media about alcohol-free lives and people really promoting that. And so I think I'm hopeful that that is actually going to show some improvement more on like the chronic liver disease front, that people are starting to drink less alcohol and we are having like awareness about the impact of alcohol on our bodies, even in when we're younger in our 20s and 30s. The other thing that has been rising steadily pre-COVID, and I think will continue to rise, is the rise of metabolic syndrome. So I explain to my patients this is anything that predisposes you to have fat on your body. You don't have to be fat or overweight to have metabolic syndrome, but you just have that predisposition. So this can be diabetes, high blood pressure, high cholesterol. And this is all associated with an increased risk of fatty liver. And it's related to how your body regulates insulin and glucose in your body, and that exposes your liver to fat in the liver cells, which then over time can cause non alcoholic fatty liver disease.
That was a good breakdown. We're going to talk about those risk factors. So I'm going to kind of break them down separately.
Mhm.
dive into like the day to day of like, okay, overarching, yeah, that makes sense. On the alcohol front, is it like alcoholism where you have to have like really excessive intake? Can it be the even moderate intake of alcohol? Is it over time? Is it the amount at once? Like what's actually happening in terms of the liver responding to alcohol? Is it injury and then like repeat injury? Like what is, I guess, the actual risk? Because I think
Right.
that gets skipped over and people may be thinking like, oh, I only drink alcohol every now and then. Maybe that doesn't apply to me. What is the risk? Like, what does that actually look like?
Yeah, so I think there's two, again, the two groups that we talked about. So there's the acute and the chronic. The acute front, and I think this is the part that most people don't factor in, is that you could be binge drinking for a short period of time, like a month or 3 months, and you could be young, not drink alcohol before that, and you could be at risk for acute alcoholic hepatitis or alcohol associated hepatitis is what we refer to that as now. So that's kind of like on the acute front that I really try to educate young people about. The chronic front, this we believe this happens more over the course of several years. So this is like chronic alcohol use, but it doesn't have to be that traditional idea that we think of as an alcoholic. Sometimes people have like a few drinks a day and they did, they're like, well, I have a couple of glasses of wine with dinner. On the weekends, I have a couple more glasses of wine. And there are people who have more sensitive livers. So I do tell patients that I know patients who have drank their entire lives and their livers are fine. And there are people who would not consider themselves an alcoholic. They're functioning members of society. They have jobs, they have families, but they drink regularly and over a number of years. And some people have more susceptible livers and they can develop, alcohol associated liver disease where they start to have injury to the liver and then eventually can develop cirrhosis.
Thanks for sharing that. I think that that is so important and something that I mean, getting into my 30s and working with patients who are also in similar life stages, like, I think the reality of, okay, every day what we're doing, impacts our bodies and finding practical ways to be mindful about that, but also make
Mhm,
some changes. I think sometimes people very much underestimate their alcohol intake and the impact
mhm.
of and not giving your body even breaks where it's like, okay, maybe you only drink on the weekends, but it's fairly excessive and excessive is not that
Right.
much. Especially for different bodies. I'm a 5'4" female compared to my husband who's 6'4" and like almost 100 pounds more than me. Like two drinks for me is very different than two drinks for him.
Right.
And so that can easily creep up and make a difference in how you feel, but also what's going on beneath the surface. So I love the whole like dry January or like little breaks,
Right.
periods of time of more excessive intake. And that does work, right? That gives your liver time, especially with that acute injury. Removing the alcohol for a period of time,
Mhm.
alcohol induced, can help the liver recover, right?
Yes, and the liver is very resilient. So I like it's quite remarkable when you see somebody, even somebody diagnosed with pretty advanced stage liver disease. So they're at the stage where they have cirrhosis or they're about to have cirrhosis. If they stop drinking alcohol, a lot of people can actually recover. They can go back to going from a somebody with decompensated cirrhosis to compensated cirrhosis. The liver is very resilient, and so encouraging sobriety in somebody, especially with alcohol associated liver disease, is probably one of the most effective interventions. And it's one of the most reversible types of liver disease.
That's incredible. Do you find that those who deal with maybe acute, I guess more acute injury, that just taking breaks from alcohol or moderating intake works versus like with chronic cases, like complete sobriety is necessary? Like, is there kind of a cutoff point where it's like maybe you can move towards moderation versus like, this is not an option for you. Like, we really need to cut this out completely.
If you have chronic injury to your liver is already less resilient. So those are the people where I tell them absolutely not. But honestly, if anybody has signs of liver disease and they're coming to see a gastroenterologist for that, alcohol is probably the first thing I tell them to cut out because we have data that shows that it is the most impactful modifiable risk factor. Not always the easiest to implement, because we know alcohol use disorder is a serious disease and condition. But for some people, they don't know that, or they don't know that alcohol is impacting their liver. And they don't have that dependence. It's just a social habit. And so for the people that are able to cut it out, they can see tremendous changes and health improvements to their liver.
That's awesome. And yeah, I think we can't be practitioners without saying like alcohol is never really healthy, right? When you look at the gut, you look at colon cancer risk, you look at
Right.
all sorts of things. Like alcohol is not good for the body. And so it may
Yeah.
work for some people. It might be a choice you make. Everyone has that autonomy, but it's not good, right? And so it's not something we can necessarily recommend. And so the understanding it to make your choice, I think, is really important. So that's really
Yeah.
helpful to get into signs in a little bit, but I wanted to just talk through that risk a little bit more because I know it's not so black and white of like, just don't ever drink alcohol.
Mhm.
It's like there's different things that you can put in place and ways to work with your doctor, work with your team if you're dealing with more of the alcohol related side of it.
Yeah. And for the more moderate drinker, the risk of alcohol use is not so much to your liver, it is actually the cancer risk. So there are a lot of studies that show that alcohol use, even in a moderate drinker or social drinker, that does increase your risk of cancer. So I do want to highlight that, even though this is a liver related podcast. And then the other thing I would add is there is like a lot of people tell me, oh, but I drink red wine only. That's like a myth that's out there that they're like it's okay that red wine is actually good for your health. I enjoy drinking red wine, but I am not under the pretense that it's somehow better for me and that I'm actually doing something to improve my health.
Yeah, it's
It's
like a
advice, just like chocolate or just like sugar is
yeah,
advice.
yeah, yeah. It's like the early Mediterranean diet research where it's like the red wine is the secret. It's like, well, it's probably the grapes
Yeah.
that
Yes.
make for a benefit. You're gonna have more benefit eating grapes, eating berries, eating things like that versus and the same with cocoa. Like cocoa is beneficial, but in really sugar-rich chocolate and that being
Right.
eat, probably not. It's like making sure that there's
But I enjoy chocolate, so I eat chocolate and but I am under no false pretense that it is, going to somehow increase my life if I eat like tons of chocolate every day.
that's true.
It
And
makes
then
me happy, but
for drinking wine every day and like you mentioned, right, every person is different. There's other factors. And getting into the other piece that we're going to talk about, the metabolic side. I feel like the
Mhm.
more that we've learned on the GI side, on, the metabolic side, the cardio side, even looking at the brain, longevity, metabolic health comes up again and again and again and again.
Mhm.
It used to be, I think, just labeled weight, of like your weight, your BMI, whether you have
Right.
fat or not, and your, body composition versus now we understand the metabolic piece so much more. And that's a huge piece of this whole puzzle too, outside of the alcohol part. So before we get into like decreasing risk there, I think that's probably the most nuanced area where we talk about risk factors. So you kind of started talking about metabolic health, and you did talk about the predisposition to fat accumulation, regardless of fat accumulation itself. So can we break down some of those specific risk factors, maybe lifestyle behaviors, genetic factors, like what is really going on that's creating the problem?
I would think of it as like the same risk factors to having diabetes. So we do know there's a very strong familial component to that, and that diabetes runs in families. In the same way, the same pathways that are working on your glucose metabolism, that's also affecting your liver. And so we know fatty liver, or we used to call it non-alcoholic fatty liver disease. It's now been retermed to metabolic associated liver disease, does run in families. So there's a really strong genetic component to that. And there are a lot of people who come and see me and they're like, I'm not overweight. Like I exercise, I'm not overweight, but they have prediabetes and they also have fatty liver disease. So we know that there's this really strong genetic risk factors. And this tends to run more in certain populations. So Asian populations, South Asian populations, Native American populations, they have a higher risk of having metabolic associated or fatty liver at normal BMIs. And we know BMI is not a perfect measure of your weight and your overall metabolic health. And then there's a really strong lifestyle component. So if you are one of those individuals, really emphasizing, diet is really important. And there's a lot of debate and studies about which exact diet is the best one. There's a lot of data for the Mediterranean diet, but I'll say that that's not the only one. There's some evidence that intermittent fasting can be helpful for fatty liver disease. And then exercise is a really big component that I talk to my patients about, that exercise independent of weight loss can also impact your glucose metabolism, your blood sugar metabolism, and that can really make a big difference in improving fatty liver.
That's great to talk about. When you look at the things that we're trying to improve, would you say that it's insulin resistance, glucose metabolism, like that piece, which can definitely be modified by diet, exercise, and again, will be personalized based on history and maybe
Yes.
age. We could get into perimenopause. We could get into all the sorts of
Mhm.
that, which is complicated, but that allows for some of that nuance and personalization. And then there is a focus on fat storage itself. So regardless of weight, but fat itself. And is it still true that on the fat side of it, that it's less about overall like fat storage and weight and more about like abdominal fat storage? Is that still true? Or am I a little
Yes.
outdated?
Yes. I think there's still that idea about like visceral fat and how that, like, having that kind of visceral fat around your organs does predispose you more so than somebody who carries fat in different parts of their body. I actually had a professor at UCLA where I trained who told me that sumo wrestlers do not develop some of these like weight related complications. We think of sumo wrestlers as people who are overweight and fat, but because of like that exercise component and their diet and where they carry fat in their body and like whether that surrounds their visceral organs like their liver. And so that's a big component about fat distribution.
Yeah, I always found that interesting in school too. And I think that was a period of time where we used to term, I think it's like 10 to 15 years ago, but the whole skinny fat, which I hate to
Right.
use. I don't know if that's very helpful, but it did help us understand, like in my schooling, even like that the whole like weight itself and BMI, like it's a helpful, yeah, to track weight history is more helpful. But understanding that someone may be a completely normal weight, someone could probably less likely to be underweight, but could technically be underweight and still
Yeah,
have visceral fat accumulation. And it doesn't always look like a big belly, quote unquote,
exactly.
but there could still be some fat based on genetics and even
Right.
lifestyle. And someone who may be a higher weight may be totally healthy and fine and not have any of those risk factors because their weight is in different places, whether that be muscle or someone who just eats differently. And then we started talking about a waist circumference, in terms of metabolic health and looking at cardio risk factors of your waist compared to your hips, which kind of leaned into that, as well as like body shape, which again, I don't like that phrase as much either, but just understanding the different factors or beyond just weight itself or beyond just BMI.
Yeah.
That all brings up, I think, one of the hardest parts of this conversation, which I definitely want us to get into, is how do we actually identify the risks, right? You mentioned a lot about genetics.
Hmm.
You don't know, like your genetic
Yeah.
someone has dealt with, liver disease, or you're younger, you don't know. You do drink sometimes. Is it too much? You don't know. Like you may feel like, okay, well, maybe my weight is higher, but is it a problem? Or I don't have any of these major signs. So I want to walk through some of the different kind of signs that you are looking for.
Hmm.
Maybe we can start with signs of like, oh, this is clear liver disease signs of like you've got clear liver injury or like you're showing signs versus like early signs to start maybe bringing this up or get screening.
Yeah, so I think the more obvious signs, or like one of the most common reasons people get referred to a gastroenterologist about liver disease is, they get their blood checked, their labs checked, and there's something called liver function tests. And so those are can be elevated and someone gets referred to a gastroenterologist for that
Are
person
those
to for
different
that
than
reason.
ALT, AST?
Those are AST, ALT. There's also one called alkaline phosphatase, and then there's bilirubin. So that it's funny. A lot of people will tell me I don't have liver issues because my liver tests are normal, which is also not true. You could have normal liver tests but still have liver issues. So it's not a perfect marker, but it is one indication that there's something going on. Other more like obvious signs, so you could start to have signs of cirrhosis. So that's ascites, fluid in the belly, hepatic encephalopathy, which we talked about, that confusion. And then you could also have signs where you have low platelets. There's lots of different things that can cause low platelets. You could have low protein, so a specific protein that's made in the liver called albumin. So these are all typically detected by lab work. If your bilirubin is very high, you develop jaundice. So that's the accumulation of bilirubin in your body, but you notice that it's like yellowing in your eyes, yellowing in your skin. These are signs of like more advanced or more serious liver disease, like should see a doctor right away about this. But, a lot of people will come to me because they got an imaging test, like an ultrasound or a CT scan for another reason, and that shows fatty liver. And the thing is, fatty liver is really common in the United States. Like the estimates are somewhere like 1 in 4, 1 in 3 people have fatty liver disease. So that means there's so many people out there who are not even aware that they have fatty liver disease. And you could have all normal labs, no symptoms and signs. That's probably the most common presentation of fatty liver. And it's just that when somebody imaged your liver, we see that there's fat in the liver. And so
Is
it's
that
hard.
Yeah, it's like, is that the only way to test for fatty liver at the start is just through imaging and looking at the enlargement of it? Now for a quick word from our sponsors with resources that might support you. Honestly, as someone with IBS, I find that I just feel better when I stick to a low FODMAP diet. And when life gets busy, having low FODMAP meals on hand helps keep me steady. The hard part is I usually need those meals most when I'm already stressed. And that's exactly when I don't have time to shop, cook, and prep my meals. That's where Modify Health has been a lifesaver. It's like having a private chef who actually understands the nuances of the low FODMAP diet. No guessing, no label reading, no extra work. I just choose the meals I want, they show up at my door, and I have delicious, fully prepared meals ready to reheat and enjoy in minutes. Complete peace of mind. So if you want to discover the benefits of a low FODMAP diet, but you're not sure where to start, let Modify Health make it simple. Check out modifyhealth.com, select your meals, and save 35% off your first order, plus get free shipping across the US with the code THEGUTSHOW. All one word, THEGUTSHOW. Did you know that elemental diets have been used in GI care for decades, especially for chronic digestive conditions like IBS, SIBO, Crohn's, and EOE? An elemental diet is a short-term, liquid-only protocol that provides pure, comprehensive nutrition that's more efficiently absorbed with very little digestive effort, which allows most of the GI tract to rest and reset. In 2023, researchers studied Embiota Elemental, specifically in those with SIBO. In that study, every participant completed the protocol, 83% eradicated their SIBO, and many saw improvement in their symptoms. Embiota is the next generation of the elemental diet. It's the first formula that's both clinically effective and genuinely easy to drink. If you're looking for an option to support SIBO or your gut, Embiota Elemental may be one to consider. Learn more at embiota.com, that's MBIOTA.com, and save 20% off their 2-week protocol with the code GUTIVATE, GUTIVATE, GUTIVATE. Early on in my journey with IBS, I learned I was lactose intolerant, so I was popping Lactaid with everything that I ate. But honestly, I still would end most meals feeling really uncomfortable, painful, bloating, a lot of gas, so it just wasn't cutting it. It's not until I learned what FODMAPs were that I realized I was intolerant to more than just lactose, so of course lactane wasn't working. Thankfully, I found FODzyme, an enzyme for FODMAPs. So it breaks down lactose like Lactaid, but also breaks down the GOS in beans and fructans, which are the largest FODMAP group, including things like wheat, garlic, and onion.
It's also more effective than lactate and other enzymes because its powdered form mixes directly with what it's targeting, making it even more effective. So now I just sprinkle Fodzyme on to eat more confidently and get better results. If you want to try Fodzyme for yourself, go to fodzyme.com and use the code THEGUTSHOW, all one word, THEGUTSHOW, for 20% off your first order. And now let's get back to the show.
It's not the only way to test, but there is actually a more sophisticated test called a fibroscan that actually it uses ultrasound waves to detect like scar tissue in the liver. So we'll talk about fibrosis at some point in the liver, and then also it actually quantifies how much fat there is in the liver. But probably the most like kind of quick and dirty screening test is if you get an imaging test. So we don't have great ways to screen for fatty liver right now. And really, we're trying to do a lot of education in the community and amongst primary care doctors is to start thinking about screening people for fatty liver disease if they have some of these associated comorbid conditions. So diabetes is a really big one. And then some of the other ones, high blood pressure, somebody who is overweight or obese, high cholesterol, some of these conditions that we know go with fatty liver, that might be an indication to then start looking beyond lab tests, but looking at imaging. But we don't have set protocols in place currently.
I really hope that that changes, just because I think that there's so much prevention work, like you mentioned, that so much can be reversed. And then you did also mention that problems occur when things are not
Right.
going well. So it's like it kind of can get someone stuck in this really hard cycle to get out of when you're dealing with diabetes, and now you have blood cholesterol issues, and you're dealing with your liver, and maybe there is fat accumulation, and now you need to exercise on top of that. And then we could throw in bone density, we could throw in all sorts of stuff, right? On top
Right.
of all the things that can kind of spiral with this. And so it's important to recognize it's rising, but how do we get on top of it, which is so hard. And so would you say that more often than not, the metabolic signs, like even showing a trend towards pre-diabetes, or like you had mentioned, like blood pressure maybe changing and cholesterol elevating a bit, and some of those like trends, do you tend to see that come first before the liver's affected? Does that happen in reaction to the liver? Do you feel like that kind of spirals it once the liver kind of becomes part of the picture? So would people be looking for those trends?
I think it's all going on at the same time, to
Okay.
be honest. But it is that it's just easier to detect those other things because, you go to the doctor, they measure your blood pressure. We have great diabetes screening tests, and like a lot of people get screened for diabetes. So I think those are often detected first, but only because they are easier to detect.
Yeah, that totally makes sense. And when we talk about, reversing this, we've kind of talked about the alcohol side a bit, but looking more at the metabolic side, if someone suspects that they have this, the good side is that a lot of the reversal tips are also strategies for diabetes and strategies for cholesterol.
Mhm, mhm.
So I would love for you to talk about this, of how much reversal is actually possible. And you mentioned that you can get, even in the first stages, you can see some reversal, and then what actually works to get you there.
So I think the main things we counsel patients on, and traditionally we've done this for years, is like, weight loss. And when we tell them like somewhere between like a 5 to 10% of weight loss can make a huge impact on your liver, and we see that pretty consistently with patients. But weight loss is hard, and I like a lot of people who already have been dealing with metabolic syndrome and obesity, like it's not like they haven't been trying to lose weight. So that's something that to be really cautious about and like understanding of when we talk to patients. And so I always like to talk about other things they can do in addition to weight loss. So thinking about exercise independent of weight loss, we know that there's data that suggests that that does help with either stabilizing fatty liver, non-alcoholic fatty liver disease, or helping with some of that reversal. And then now we actually have medication. So for many years, and I think this is part of the reason why we were not very good as a medical community at screening fatty liver, is that we didn't if we detected fatty liver in someone, we didn't really have anything to prescribe them besides what they already knew from their overall health, is that they should work on like weight loss. And it was kind of demoralizing. You would see someone and you would tell them, "Oh, you should lose weight," and they're like, "I already know that. Like, tell me something new." But now we actually have medications. One that was recently approved specifically for not a metabolic associated liver disease. And then we can also talk about GLP-1s. So medications that are targeted for weight loss, but have also been FDA approved now for people with fatty liver disease with fibrosis. So more advanced stages of non-alcoholic fatty liver disease.
Definitely going to bring that up and ask about GLP-1. So I'm glad that you brought it up, because I've been so fascinated at conversations. And I mean, you're going to hear this a lot this season of the podcast,
Right.
as we're talking about some of these other conditions. I think since GLP-1s are being used more frequently, we're learning about their effects.
Mhm.
I don't know. And then now they're like, hey, I'm more interested, and I don't prescribe this.
Mhm.
It's not really my role anyways, but understanding even potential anti-inflammatory effects, and obviously
Mhm.
regulation, which was their original use within the diabetes population, is really interesting. Are you finding that you're seeing microdosing GLP-1s is that, I know, the big next topic on all of this? And that's what I'm most interested in, of like, how do we eliminate too much rapid weight loss, which can also be kind of scary? How do we eliminate maybe decreased appetite, which is a whole lifestyle change to like meet
Mhm.
and deal with decreased appetite, potential risks of slowing the GI tract, especially for like our constipation people. And, I assume constipation probably overlaps quite a bit with fatty liver, because it also overlaps with blood sugar dysregulation, and even, metabolic issues, and less exercise and all of that too. So are you finding that higher doses of GLP-1s are necessary in this population, and that more rapid quick weight loss is the key? Do you find that even like micro doses or the lowest doses are showing a lot of benefit? Like, I guess, how are you using them in your practice, or how are you finding them helpful?
Yeah, so I think most gastroenterologists, myself included, have not started prescribing them ourselves. So typically, what we've traditionally in the past few years have been doing is having patients who would otherwise meet the criteria for a GLP-1, and then have them follow up with like a endocrinologist or obesity medicine doctor to get GLP-1 prescribed. And I think the data is still relatively new. I would have to say I'm not as familiar with specifically micro dosing of GLP-1s and that impact on fatty liver disease. But there is data that show that even without weight loss, GLP-1s can be beneficial for fatty liver disease. So it's sort of independent of that weight loss piece about managing fatty liver disease that has been shown. And I would specifically say that the people who are FDA approved, or most of the studies, are people who don't just have fatty liver, but they have scar tissue related to the fatty liver. So these are people with fibrosis, so more advanced fatty liver disease, that have really showed the benefit. But most gastroenterologists, I think we're starting to talk about it now that it's actually been FDA approved. So previously it was being used off label, have been starting to talk about, oh, is this a part of our practice that we should incorporate as gastroenterologists?
Exciting. I think an exciting future.
Yeah.
And even I think the conversation's also shifting from, if you're on GLP-1s, like obviously getting them from reliable practitioners,
Yes.
not maybe just getting them online. Like, I know that access and cost, and again, there's more to this conversation than just that. It's easy to say, like, make sure you're getting them from your trusted provider. But I think it does open up new opportunities for like, okay, which ones work best for certain things, understanding mechanisms, understanding
Yeah.
dose, and maybe even reducing side effects, and all these things that we're seeing a lot of potential for now that people are open to using them. Again, they're more approved now, we can study them more. It is really interesting, and obviously they're not independent of diet and lifestyle interventions.
Hmm. Hmm.
And with the gut, we know that too, right? It's like you could lose weight but still maybe even increase risk for other things. You could lose weight and drink alcohol nonstop,
Right.
probably not end up in a great place, right? So there's a
Right.
lot
Now.
that are necessary to make a difference. And you have alluded to, kind of getting back to, okay, the practical side, right? You alluded to the exercise piece of exercise, even without weight loss, showing a benefit. Do you think that that's more to do with maybe changing of fat stores with muscle accumulation? Do you think it's because muscle accumulation helps with blood sugar regulation. Like, why do you feel like exercise, or do you even know, like through the research, why is it that exercise makes such a big impact?
Yeah, so I think it is like building your muscle mass. So whenever patients with fatty liver come and ask me like, "Oh, what kind of exercise should I do?" I always tell them like whatever exercise you like is beneficial, but I do try to put an emphasis on weight-bearing exercise. So building that muscle mass. And because we know having increased muscle mass plays such an important role in blood sugar regulation. So that's, I think, really the key there is that the idea that blood sugar dysregulation is a key driver for non metabolic associated fatty liver disease. And so that's really what I try to emphasize to patients.
Yeah, absolutely. I think this is the year of resistance training. Everyone needs to perimenopause. We talk about that bone density, gut health. All we need resistance training and daily exercise, daily movement. I love that, especially in relation to diet. Of sometimes you can't out diet or sleep. You also can't out diet a sedentary lifestyle. You could have the quote unquote perfect diet and never move your body and not end up great. You could also have a not so perfect diet and move your body consistently and end up in a
Mhm.
so we definitely don't want to disregard the power of movement. And then even with diet, it doesn't have to be so complicated. I think even the focus of ultra processed foods, it's like we could demonize specific foods all day, but like really eating whole foods the majority of the time, cooking more, getting
Right.
variety, add in some plants, build in some extra virgin olive oil, some fatty fish, incorporate these foods that are promoting and supportive. And it doesn't have to be so complex where you never get to eat a piece of chocolate ever again, or sugar is never allowed in your diet. So even those who are dealing with blood sugar dysregulation, sugar can still fit. It's fiber, it's pairing of that, it's protein.
Right.
There's so many pieces to it that don't have to be so complicated.
Yeah.
With your patients who decide to take more of a diet approach, that those who make some of the smaller adjustments like tend to end up in a better place than those who try to do like a complete 360, or kind of what do you see in terms of diet, or I guess what people are doing after
Yeah, I think the emphasis I always put in with like with any of my patients is that it like don't let perfection be kind of the enemy of good. So, and I think you alluded to this. Like, it's really important that there's probably multiple lifestyle factors to address, and over trying to over perfect one thing. So, like being very absolute about your diet, it can like affect all these other pieces. So kind of doing like 50, 70% on multiple different things probably has a more impactful cumulative effect on your lifestyle, and is probably more achievable, sustainable. So it's really important to think about what is actually sustainable, what is a lifestyle change that I can actually make, because yes, you could think about like, oh, I am never going to eat another gram of sugar again, but is that really sustainable? And is that going to then take away from your time exercising or your time getting adequate sleep? And so all these things really like, I think achieving some of it is probably better than trying to reach perfection in one particular area. And, I think so much about lifestyle changes is related to psychology and sustainability. So I always tell people, like, just try one thing that you can achieve and do things one at a time. There's this whole, science behind turning a habit, turning a lifestyle change into a habit and something that's implementable. And so I'm really interested in that piece of it as well. And I think that is, I just don't want people to be discouraged. I think it's very overwhelming, and to think about, oh, I have to make all these lifestyle changes. And so I try to think about like educating about one small piece at a time, and like doing things, 1 pound at a time, or like try to exercise like 1 day a week and then build that up to 2 days a week. So I think that is much more sustainable than, especially since it's January, like thinking about New Year's resolutions and like every day you have to run 5 miles. That's just not sustainable, at least for me.
Yeah, I totally agree. And making 50 changes in January that don't last past January doesn't work, but making one change a month and even making 12 changes by the end of the year, like, but you keep them going, that does matter. And I think something to emphasize is, you talked about reversal quite a bit, but those who are dealing with both on the alcoholic side and the non-alcoholic side or the metabolic side, when we're talking about chronic liver like issues in that progression, it doesn't just go away, right? Like, once you've had any kind of like fatty liver or liver damage that wasn't just acute, like you're at risk, right? So there is this lifestyle long-term piece where the things
Mm.
versus the damage need to be in place long-term to consistently prevent that damage, right? Since there's such like a genetic component to it.
Yeah, and I've actually had patients who you'll see spikes in their liver function tests during periods where they've like gained and lost weight. So I've had patients where I'm like, oh, like what happened here? And they're like, oh yeah, I gained like 15 pounds here. And then you see this improvement. They're like, yes, I also lost weight at this time. So I think that people who are predisposed to having liver disease, we know that they have more sensitive liver. So that sustainability is a really important piece as well.
Yeah, just like having IBS or having prediabetes or those who deal with PCOS and metabolic issues there. It's like there's chronic management of the chronic condition and the chronic problem. It's not that you cure it and fix it currently, unless like even a transplant, I would assume you don't necessarily cure it, you kind of restart, but then there's still that you have to keep managing it, right?
Yeah. Yeah, and it's funny because people which think that transplants, like, once they hear that they have cirrhosis, they're like, "Can I just get a transplant?" And the thing is, people who have liver transplants are some of the sickest people that you'll ever see in the hospital. They spend months in the hospital before and after. And then after that, your liver is so susceptible because it's a transplanted organ and you're on all these immunosuppression meds. So I try to like tell people, like, you don't want a transplant unless you absolutely need to. It's not a quick fix. It's much better to try to work with the liver that you have.
Absolutely. We can't end this conversation without also talking about supplements.
Yes.
Because as you're talking about the liver, if you're on social media, and I feel like this kind of took a bit of a break, but I feel like it's going to come back because the more we talk about like liver disease and all this, like it seems to always rear its head, I feel like every few years. But there are liver detoxes, there's
Hmm.
supporting supplements. We also talked about how the liver kind of processes everything, including supplements. And
Hmm.
one cause of even acute liver damage can be supplement use. I see that in practice sometimes. So, can you talk a little bit about supplements and do we need supplements to support the liver? Is there a role for it? How harmful is supplement use to the liver? Like what should we be looking for? Like let's talk about it.
Yeah, so I think any doctor who takes care of liver patients has seen somebody who has otherwise healthy and has had like, liver injury, even liver failure from supplement use. So, for the most part, most liver doctors that I know tell people to steer away from supplement use, like liver detoxes, liver cleanses. These are all chemicals that somebody is trying to make money to sell to you, and there's just not enough evidence to support any one of these medications or supplements. And what you alluded to in the introduction to this topic is that your liver's job is to process all these chemicals. And so supplying extra chemicals to your liver while your liver is already not doing well, it can put your liver at risk for injury. And we know that the supplement industry is not well regulated. So there are a lot of contaminants in these supplements that can actually cause liver injury. And supplements are not well studied, so they don't go through the same like rigorous trials. They don't look for complications in the same way. And so for the most part, I tell my patients to stay away from supplements. So there are some supplements out there like milk thistle, vitamin E that have some weak evidence that might benefit certain people with certain liver conditions. For most gastroenterologists and hepatologists, the evidence is not strong enough to recommend that to people. A lot of the supplements that you see out there, the liver detoxes, they'll take these like small studies and then try to incorporate and package it in like some fancy liver pill or drink. And I wish a supplement would work that would make things so easy, but I think really what we're learning with the liver is less is more. So trying to remove exposure to chemicals and toxins, it's much better than adding something on. There is one thing that has been consistently shown in studies to be beneficial to the liver, and a lot of gastroenterologists and hepatologists will recommend this, is coffee actually has a beneficial effect on the liver. This has been shown to help people with reduce fibrosis, so scar tissue in the liver, and also help people prevent complications who already have liver disease. So I tell patients, if you like coffee, even if you don't like coffee, but you're willing to drink coffee, that can have some small beneficial effect on the liver.
We could queue up like the TikTok video, like, come with me to detox my liver with my morning cup of coffee.
Yeah, exactly. But people love that because most people love coffee, and so I know there's a lot of demonizing of coffee on social media, so people
Yeah.
feel happy when they're like, "Oh, I can drink coffee." And the studies have also showed that decaf coffee, instant coffee also have benefits. So it's not because of the caffeine.
Nice little benefit. And all my
Yeah,
constipation people out there, like me, that love our morning coffee to keep things moving, which is totally cool. You can also have it for your liver. I'm
exactly.
glad that you brought all of that up. I think, something that people forget a lot of times, and even like in the supplement world, like a lot of these natural like herbs and, natural supplements, there's a thought, we could talk about SIBO and in that world, we can,
Mhm.
talk about even the MCAS mast cell world and, all these things that we're learning about the gut. And I think sometimes we swing a little too far over when we're like, oh, well, no, we don't want medications and we don't want to have to treat these things with, more of these conventional methods. But if we use these natural forms, like really high doses of ginger and different herbs that have maybe some antimicrobial properties, like the theory is great, but even these natural things dose at a level that you would not get through food, like over
Right.
a long period of time, like that may not actually be supportive and helpful. And I've seen it way too often in practice where I see someone who's been through like mold exposure and bacterial infections. And then they got hit with a viral something. And then they're constantly in this process of like treating themselves. And then they, succumb to the whole herbal approach because they think that that's necessary because their treatment didn't work fast enough. And then they just
Right.
repeat injury both to their microbiome, but also to their liver. And then they start having, signs of liver inflammation and all these other problems. And it kind of can spiral and people get really surprised by it. And I've had patients
Mhm.
who have been really mad that practitioners didn't warn them. And I always make a joke that in my next life, maybe I'll be an attorney because I've learned too much that there's a lot of things that are not going right in this space that need to be addressed. And I think a lot of people are recommending things without really considering the potential harm.
Yeah.
And so it is really important. And I'm very pro supplements for some reasons. I think it can be helpful. As we end, I think one thing I do try to recommend, and I'd love your opinion on this because people may be listening, they're like, well, I do drink alcohol, or I am working on these things, or I'm trying to work on my diet and lifestyle, but you told me not to make changes too fast. Like, but I'm also taking supplements. And how, like, when should we be screening? Like, is it annual blood work? Is that enough? If someone is maybe has these risk factors in their day-to-day life, should they be screening themselves more, working with their doctor more closely? And then if you do see signs of fatty liver, like we have the diagnosis or we have okay, this is probably the case, let's start making changes. How often do you monitor if the changes that someone's making are working?
Yeah, so I think with the screening piece, I just don't think we have good guidelines currently. If I see somebody who has those risk factors, I do talk to them about, thinking about getting labs or ultrasound. So I would say the screening piece, I think it's going to be changed soon because now we have these new treatments. So what I would educate people on is that if you have risk factors, it is worthwhile talking to your primary doctor about fatty liver or getting your labs checked just to introduce that conversation. If and then in terms of yeah, so I think it depends. So if you have fatty liver without scar tissue, so without fibrosis, I think that can be monitored, through your primary doctor once a year. Depending if you're making lifestyle changes, sometimes it's helpful for people to kind of get more frequent monitoring, but it does take a while for, even if you lose weight, it does take a while for that effect to like reach your liver. So, 6 months yearly monitoring. For somebody with fatty liver with fibrosis or scar tissue, if those patients are seeing a gastroenterologist or hepatologist, which they should, typically they usually get monitoring, depending on like their specific circumstance, again, like the 1 to 2 times a year, but they should probably be monitored by a specialist.
This is jam-packed. So thank you for sharing so much information with us. As we leave, is there anything else you want to say, or how can people best connect with you moving forward?
I think there's so much more I want to say about the liver. We probably could have done 2 episodes about this. I do want to acknowledge that there are other causes of liver disease. So we primarily talked about alcohol and metabolic associated liver disease here. For as a gastroenterologist, there's autoimmune impact of the liver. We know there are a lot of autoimmune conditions related to the liver. There are some metabolism related pieces of the liver. So anytime I post about liver disease, I have a lot of people on social media remind me about that. And then viral hepatitis. So hepatitis B and C are common causes of liver disease. So being aware of that, getting screened for that, getting vaccinated for hepatitis B. I know that's an important conversation to have now. And then we didn't get a chance to talk about this medication called Resdifra or resmetirom. That was also recently FDA approved for fatty metabolic associated liver disease with fibrosis. So I think really important to note that there are treatments out there that a gastroenterologist or a hepatologist can discuss with you. So we have new treatments out there, which is why liver disease is such an important topic. So I post a lot about the liver. I think it's a really important part. So you can learn more about the liver at SoCal GastroDoc. I'm on Instagram and TikTok, and that's SoCalGastroDoc.
Perfect. And we'll link both of those in show notes. So if you want to click a link and get there, I'll put those. And I'll also just say, like, Dr. Wendi also posts things about IBS and posts things about just general digestion symptoms and tips and all of the good stuff. So, and funny things. I love a good humorous connection point to problems that we all have. I think it's a great way to laugh a little bit, but also gain community, which is also so important. And so you'll find all of that there as well. So very highly recommend giving her a follow, either platform that you want to. Dr. Wendi, thank you so much for sharing this. I agree we could talk about this for hours, but I appreciate you being so open and sharing so much with us. And I look forward to maybe another conversation in the future.
Yes, absolutely. Thanks so much for having me.
Are you listening to today's episode with the main thought being, what are the steps that I can take to get rid of my symptoms right now? While I hope that the information that we share in every episode of The Gut Show leaves you feeling more empowered and more confident in your body, it's not always going to solve your problem or give you a clear direction for your specific symptoms and your needs. The Master Method membership is an online program for the person with chronic digestive symptoms and IBS who wants step-by-step guidance to understand their body, address the drivers of IBS, reduce symptoms, and build resilience in your gut long-term. This membership includes a step-by-step course and a dietitian-led community that teaches you how to holistically address each symptom and the IBS drivers, how to reduce symptoms more strategically and with confidence, and guidelines for better gut health long-term so that you're not only thinking about today, but you're also improving your outcomes in the future. It is time to ditch the symptoms and get your life back. The membership is your first step. You can learn more and enroll at ibsmastermethod.com and use the code GUTSHOW, GUTSHOW, GUTSHOW for $25 off your enrollment fee.